Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we have a very special guest. Every now and then we have someone who actually went through our process and so graciously is willing to share their story on the podcast. So we have Amanda Gerber, and she's with us to, share her story. Thanks for being on the podcast.
Yeah, it's an honor to be here for sure.
So what we want to do when sharing these stories is highlight you and everything you've been through. I tell everyone I interview that are patients that it needs to be, or it can be real, right? And so and we want to pull out certain things that other people can relate to. Part of the reason I asked you is because I think there's a lot of things that you can, in your story, people will relate to. But if you don't mind, really just recapping for us when it started and kind of your journey, things you tried, different providers in the healthcare system you saw, things that stick out in your mind, all the way from day one when you got a headache.
Mm-hmm. Yeah, it's interesting to think back on day one because you never know that day one is day one for something that's going to go on for so long, right? And so, day one for me was sometime in the end of elementary school, around fifth grade. And I have a feeling that probably hormones were at play in that onset, but went from a pretty healthy, normally functioning child to just getting laid out by these migraines. And they were happening weekly during that time when they were first coming on. And we're pretty severe, pretty intense. And so I just remember, for whatever reason, I think there must have been something happening over the weekends, whether it was sleepovers or something else that was a trigger, because I remember missing Monday of school frequently throughout fifth grade, sixth grade, seventh grade, because I would have this, one-sided migraine pain, very typical presentation. And then, that would lead to this throbbing and light sensitivity and almost always vomiting. And so, that would take, even if my migraine was gone by Monday, I was still recovering and catching up at that point.
Yeah. I'm sure, jokingly, a lot of people would love to skip Mondays, but you were not loving your Mondays.
I was not loving my Mondays. I was not trying to get out of anything at that point with these migraines. So,
absolutely.
Yeah.
I think, and that's an interesting point, because oftentimes in kids, parents will think, maybe a couple of things. Like, one, is this real? Is this something you're actually feeling? Because my head hurts. There's nothing visibly wrong.
Mm-hmm.
Did you have that at all as a kid?
Yeah, absolutely. And I have so much grace for my parents in that, because I'm sure they were like, what's actually happening? And I have my own kids now. It's hard to know. Right. There is no way to gauge, a pain level in someone. And so, I remember everything from, them asking, okay, are you sure you need to stay home from school again? Right.
Mm-hmm.
Having those questions, trying to think through that. And an interesting effect of that, which I'm sure some people would identify who are listening, is you start to wonder in yourself, what am I experiencing? I think there's this whole psychological component to pain. And, part of that, my journey over the years has been, is this actually a thing? Is this actually as severe as it feels to me? Am I making a bigger deal out of something than it is? It's hard. It's hard. There are measurable symptoms along the way. But I think it wasn't necessarily just other people, it was myself. And so I remember, this was happening in childhood, but then through adulthood too, just learning how to push through, going to things, doing things, and almost trying to ignore the symptoms. Obviously, it gets to a point many times where you can't ignore it anymore.
Right.
But I have a very vivid memory of going to a concert with my family And I had a migraine going into the concert. And I'm sure, again, people who know what this is like, the light sensitivity, the sound sensitivity, know that that's almost the absolute worst thing you can do with a migraine. I remember just like just having, I don't know, again, a vivid memory of the music playing and leaning over in my chair and trying to, cover my face and barely making it home before I, had to go, just had the vomiting response to that. But that's, that's miserable. I didn't enjoy 1 second of that concert, but it's like, what do you do? Like that's another thing that I'm sure people would identify with is,
Okay. So at what point did you start seeing different providers or taking medication, or did that journey start when you were a kid? And I'm sure it sort of evolved through the years to, just trialing all sorts of different things.
Right. I would say as a kid, what I experienced more, or what we tried more, were, the lifestyle changes. I remember at one point just realizing that going to sleepovers, it's interesting when a kid realizes that, right? Like my parents would suggest things like that, but realizing, if I go to a sleepover, if I have soda, if I, there were things that I started to notice, if I, so it was kind of trying to troubleshoot and figure out, okay, what are things I can change? And I'm thankful for that. My parents did not just immediately go the route of medication. It was more as I got older into my teenage years that I started to, have more control over, okay, I'm going to take ibuprofen. Okay, I'm actually going to take 2 ibuprofen or 3 ibuprofen. I remember going on a trip, youth conference trip with my church growing up. And I remember that was the first time someone was like, why don't you try 3? Because I wasn't sure how I was going to get out of the hotel room that day, and actually function. And so I explored chiropractic on my own then in college. Everything I've tried, there's often some marginal benefit. I also have so much respect and give the benefit of the doubt to all of the people who have, been there along the way and tried to help me. I think everyone was probably doing the best they could with what they had to work with. Tried chiropractic, tried functional medicine, as an adult, did a long program there. Again, marginal benefits. But what I felt like was lacking often was someone who could actually explain to me what was happening in my body.
Sure.
Or even connect the dots of the various things that I was experiencing. Because as many people know, it's not only pain in your head that you're feeling, right? Like your energy levels are affected. There is a lot that I attributed to my sinuses for a while that now, having experienced so much relief, I'm realizing I don't know that my sinuses are as big of an issue, as I once thought they were.
Right.
And so,
Yeah, I think one thing that your story in particular, it's able to tie together a lot of like confusion that people have. And so people, they go on this journey and they look for data points. And a data point might be like, this thing is a trigger, or this is something that I feel, whether that's like, maybe sinus pressure, or maybe like jaw pain, or I get a headache when the pressure changes, or when I eat certain foods, like, when I drink soda. And so people will look for those specific things and attribute that to like, okay, this is the problem, or that is the problem. And I think what you're saying is having someone who can tie all that together is really helpful. And that's what we try to do. Another aspect of your story that is fascinating and something we hear relatively frequently compared to what most people would think is your experience with COVID. So tell us a little bit about that.
Yeah. So after my functional medicine journey, which was back in 2018, that was probably the most improvement and relief I had experienced all along the journey. And then COVID hit, and I did not come down with it, or was not sick with it through 2020 and early 2021. But then I did get it late 2021 and then twice in 2022.
Okay.
And it wasn't actually until later that I started to suspect that that was actually playing a significant role in things. But it was more in hindsight. Because, again, as many people probably experience, sometimes you have these seasons that are worse with headaches, but they kind of sneak up on you. It takes a little while till you actually realize, okay, I'm getting way more headaches than I was 2 years ago. So that was kind of my experience is I started to realize, wow, this is happening a lot. I don't think this was just a week. I don't think this was just tied to this part, this part of my hormonal cycle. Mm-hmm. All of a sudden it's like, this is happening a lot. And another thing I experienced with COVID was just, it took a long time to recover. Yeah. My energy levels were affected by that. And then a very interesting thing was my exercise tolerance went way down. And then, as I had shared with you at the beginning of this journey, exercise was, it went from feeling like I could do a lot of strength training and do a lot of exercise to that being a really big headache trigger. And so I suspected that there was some tie in there. But again, it wasn't until I came here where I felt like, that was one of the biggest things I experienced here is just, oh yeah, that might, it's almost like we trust you that you see that connection.
Right. That's
kind of what I felt is some of the things I was noticing, I felt that you were listening to, and that it wasn't just random, that had triggered some kind of inflammatory response in my body that raised that inflammation tension level.
Right.
Potentially lowered the threshold as you talk about.
Yeah.
And that very likely was why I was experiencing, an uptick in headaches at that point.
Absolutely. Because before that, you were connecting your symptoms to your cycle, right? So there was like a hormonal component. A
hormonal component. I knew that sometimes foods would trigger my headaches. I suspected that stress, was at play, but I think what was really frustrating by the point that I came to you guys was just the confusion. I just felt like it felt so futile to try to actually track down what was happening because it felt like I think I remember telling you everything was triggering a headache. It's funny, I'm wearing my glasses today. I've been wearing my glasses more often again recently, but I couldn't I just went months without wearing glasses because just the slight pressure, I think, on my temples and on the bridge of my nose was enough to tip me over into a tension headache. So, excuse me.
Yeah. And that's something we hear all the time, like wearing hats, anything that puts pressure. There's that hypersensitivity that, like it doesn't make sense for glasses to cause headaches, but when your brain's receiving that painful input and it's almost like the whole system's under stress, any little sensitivity or even things that aren't supposed to be sensitive, that you're not supposed to be sensitive to, you become sensitive to because you just can't tolerate much. And so it's sort of the nuances of people's presentations and being able to tie it all together that, we find a lot of joy in that because it's something that is not happening. And not only is it not happening, but providers oftentimes will take an aspect of your presentation and say, well, this is it, right? So for example, like all the time, people say, like, I have sinus pressure. They go to the ENT and they're doing like scopes, and sure, they might be finding something that relieves a little bit of pressure, but that's not the thing. I've had people that have had multiple procedures done trying to like clear out their sinuses, and they're just chasing a symptom and not tying it together to the full picture. So, it's important to zoom out. So let's talk about I'm curious. Because I don't completely recall, but I think you were referred to us by a friend, and like, how did you first hear about us? And then what were your like first impressions as we kind of got started?
Yeah, I was referred by a friend who I had, known about her headache journey for a while and knew that she had tried a lot of things and wasn't seeing results and was, I think, basically had a constant headache, a continuous, not relenting headache for a while. and then heard her story of coming here. And this was the thing that had worked for her after trying so much. And I honestly, at that point, I probably had never been at such a desperate point with my headaches. It was affecting my life so much at that point, and, was nearly constant for me too, which I'm not even sure I realized till later how constantly I was experiencing those headaches. But yeah, so I came in here, and I remember meeting with you the first time and feeling so guarded and so skeptical. And so, because
Because they wear a bow tie.
Yeah, that's why.
Yeah.
Actually. Yeah. You should stop.
Makes
that.
sense.
But, I think having struggled, in the medical system, despite, again, trying to give people the benefit of the doubt, having had a lot of experiences, not just with headaches, but with other medical things where I felt like I wasn't trusted, where I did not feel seen and heard and listened to. And so I think I came in a place of just, both struggling to trust that someone would see and hear me. And then also, after so many years, if I add it up, it's, 25 years.
Yeah.
25 years, right, of headaches.
Like,
why would I think that something's going to work at this point?
Yeah.
Especially when it is not a drastic, surgical, crazy solution. So I was glad to read the reviews and hear the stories of others, but I did feel pretty skeptical until after about that fourth appointment that I had here.
Yeah. Yeah, that's kind of the world we live in, and it's something that it's an uphill battle, and sometimes, to be honest, on our end, like it can be pretty discouraging when we don't get the opportunity to help people. And we don't ever blame anyone, but it's just sort of like with so many people, we know that we can help them. And so, I mean, that's a lot of where this podcast comes from, of like finding avenues to get in front of people, to educate them so that we can build trust. And I mean, ultimately it's a business, and we need to make money, and we do that by helping people. But like, it's a mission, and the mission is to allow people like you to get out of this cycle. And so, we're very used to those first interactions. Like we almost, we feel like these slimy salespeople sometimes, and we're like, no, like we just want to know more about your story and let you know that we care. And like, here's how we can move forward. And I think people come in expecting like, I'm going to put my guard up because I've seen this before and you can't help me. And so sometimes it's hard to work past that. But I'm encouraged to hear you say that, because I'm sure a lot of people listening, again, like have had this for 25 years and how can you help me? So I guess if you remember, why did you continue? Like, why did you go past that first visit?
Yeah, that's a great question. Well, again, like I said, I was at such a desperate point that I felt like I have to try. I have to try something right now. How am I going to continue to live my life? I think one thing I told you was, I feel like I'm not showing up for my life. Like, I might physically be there and, taking care of my kids and making the meals and doing my job. I don't feel like I'm actually present there. And so, feeling that desperation. But I felt like you let me be where I was. And I think that speaks a lot. That builds trust, to not try to pressure me into something. I think I experienced and felt your confidence that you could actually help. I think you do. You guys are confident here that you can help. And so, I think it was helpful to realize, okay, I can start this, I can try this. And if something changes along the way, then,
then stop.
Then let's,
right.
We can make a
we'll
different
figure something
later.
out. Yeah.
And I remember you also assuring me that if this wasn't the solution, and if this didn't solve, or at least greatly help my headaches, that you would help me connect to somebody else who could help me. So we even talked about that early on, that there were other providers that you're connected to in town that address different things. And so if we got stuck along the way, and that was a very different experience than what I experienced before. And I remember also somewhere along the line in the beginning stage of the journey, you had said, I think you had kind of asked the question of what else feels relevant to this, right? And even that, it put me in a place of thinking, oh, like, yeah, I'm the one who has this, knowledge. Like, you have something to offer here, but you're actually trusting me to sift through the history of this and see what rises to the surface. And so I think there was something that shifted there where I was like, okay, yeah, what I have experienced and my read on this and my take on this matters. And so that was very empowering too.
Yeah. The patient, I mean, I guess this is going to sound similar to like the customer is always right, but patient intuition, it needs to be listened to. Mm-hmm. And so, I mean, you live in your body and you know what you experience. And as a provider, if we don't pay attention to that, we're missing, especially in a world of like specialists in our healthcare system. I mean, these specialties go into like nuances of specific parts of like the ear or, it's amazing how specialized someone can be. And so when you ask them the question, like, I have ear fullness and I get migraines and I have brain fog and my jaw hurts. And it's like, well, I just work on the ear, but if we back up and someone's like, well, I feel like they're all connected. You just naturally become a better provider because they are. Mm-hmm. And then you look for these connections and these patterns with patients and then you kind of, people trust that. So I'm glad that you reached the point of trusting us. And so 4 visits. Tell us why 4 visits.
Yeah, well, I had some interesting, response to the first couple visits. So, because I was at a point at that time where even just laying on my back was so uncomfortable. Right. Like the position that put my neck in. And I remember sitting up after the first appointment and feeling quite a bit of lightheadedness, a little bit dizzy, some symptoms that continued into the rest of the day. I mean, it makes sense to me. All of a sudden, my body's having to adjust to like, something being done to it. Right. My neck moving in ways it hasn't for probably many years. And so I remember being so tired and going home and just going to bed, bed early night. And so, trying not to overreact to that, but it wasn't that those first 2 appointments were like, oh, this feels so great and I feel so good. Right. But obviously was going to continue. And then it was amazing. Something felt like it really shifted between that 4th and 5th appointment. And I had a vacation that I went on in between the 4th and 5th appointment. So I was gone for almost 10 days in Oregon. And I, even after a long travel day on the front end of that trip and things that would normally really trigger headaches for me, I did not get a headache the entire 10 days of that trip. Yeah. And so, that spoke for itself. Right. There's no way I would have not gotten a headache on that trip before those 4 appointments. Right.
Because travel was a big deal. Like it was challenging.
Mm-hmm. Mm-hmm. Yeah. Yeah. So I think that's when I started to see something that was a very measurable, noticeable result. Yeah. And that was pretty quick. So I was surprised. I remember you being a little bit surprised at how quick I saw some progress.
Yeah, it depends. But we do have, like, we work it into the structure of how we operate where, like, some people will, commit to a full plan of care right up front, but then some people will just commit to 4, right? And so we don't know exactly how someone's going to feel after 4, but most people, we kind of hit a point where they feel like, okay, this is different and I think this is going to help me. And so typically if we can get at least 4 visits with someone, like we can show them, hey, like this is where we're going and you can trust the process. Mm-hmm. The thing I want to highlight in your situation is you were like all in, like, and that's key. People that don't do well with our process, I don't want to say like 100% of the time it's on them, but it's a relatively high percentage of people that if they don't commit, like they really just don't get the value out of it. But you were all in. I mean, you did everything we told you, and you watched like our videos, you educated yourself, you were very diligent about like taking notes, and so that's huge. How much do you think the lifestyle change that we talked about had an impact? Like what was that like for you? Like, I guess changing, was that challenging? And then did you see the value in it?
Mm-hmm. So you're asking how much of an impact did what I did outside of
right.
coming to appointments have? Is that what you're
outside
asking?
of like us just physically working on your neck,
right.
all the other stuff we talk about.
Yeah.
What kind of impact did that have?
Yeah, I think it had a huge impact. And I felt like there was an adjustment period where I think, because I did make a decision to kind of go all in on it. There was a little bit of time where it felt kind of consuming, where it felt like I was always thinking about it and what is my posture, and trying to figure out what pillow I was going to sleep on. But I think the impact has been huge of those things. In fact, I think the things that I was able to adjust pretty quickly were doing the exercises, trying to move more frequently throughout the day, working on being more mindful of my posture. But it actually wasn't until I finished those initial maybe 16 sessions that I finally found a pillow that worked for me.
Right. Okay.
And then that in itself, I actually saw quite a bit of improvement, even when I started only coming once a month. Right. And, that was just fascinating to me to see that. But I think I remember also an appointment where, because it's been an up and down journey, a little bit. And I've had sometimes where I felt a little bit of a setback with a little, a few more headaches. But I remember telling you that I felt like if I were to stop right then, even though maybe I was still getting more headaches than what I would like to, that I felt like because of the lifestyle changes, I was going to continue to get better. Like I felt like I was going to continue to improve because I had been empowered. Right. And the things I was doing at home were going to help me keep getting better. Yeah.
Yeah, I love that because in what we do, obviously has an impact. Like the physical work that we do on someone's neck, jaw, shoulders. But, we really want our patients to be empowered to make the change, and it really only benefits them. I mean, their progress, and then your reliance on us after is less. And that's partially where like things like the SAM device come in. Cause we know for a lot of people, seeing us forever to just help manage your neck it's not like a sustainable thing. It's like, I use the dental world as an analogy a lot, but it's kind of like relying on a dentist to just clean your teeth every month, and you don't really want to brush that well. Like you can do that, but it's like it costs, it's going to cost a lot more. But anyways, your diligence and follow through, I think that speaks a lot to your success outside of us physically working on it. And it's also something worth highlighting because I think sometimes the secret sauce is like, the specific technique, which there is a ton of value in that, but it's bigger than that. It's a lot of what we talk about on the podcast of just like things that you can start changing in your life. And I want you to speak to this, but is there a sense of you didn't like maybe not realizing that these things could even help until you had sort of this explanation in your mind of what was happening, and then you could move forward? Does that make sense?
Yes. Yeah, absolutely. No, that very much resonates. Because when even wearing glasses is triggering a headache. Yeah. It's hard. It's just so confusing. It's hard to imagine how something that seems kind of small, like not relaxing on your couch, in a side lying position, which is again one of the things I changed, I think.
Right. Yeah. Don't do that.
Most quickly, right. And have stuck with very well. It's hard to imagine that that's going to make a difference. But I've actually, with friends who experience headaches, or even just people, I don't know, everyone knows someone who has headaches. But when I kind of hold up my hands and explain that tension and threshold line, which I know you talk about a lot, it's like something clicks for them. I feel like every time I explain that idea to someone, it makes so much sense to them. So even that simple illustration, then, it makes sense of some of those maybe seemingly small lifestyle changes and how much of an impact they can have. Because all you have to do essentially is get those lines further apart. It's not, ideally they're pretty far apart.
Right.
But to me, it's like, even if they're this much apart, well, all of a sudden you're having 25% of the headaches you were before.
Yeah.
Is that accurate in how
Yeah, absolutely.
How you understand it?
Yes. You want the level of tension that you carry to be low, and you want your threshold to be high, so that the delta between those two is enough where you can go about your day, and no matter what is thrown at you, like you've got wiggle room, right? Your tension can increase, your threshold can drop, but it's not until they cross that we actually are going to experience a headache. Yeah, absolutely. So where are you at now? Like, speaking to the different symptoms you had and the different questions you had in your mind, and, whether it's like, sinuses, or I was throwing up, or I had the light sensitivity, where have you been since we kind of wrapped up treatment, and what kind of relief have you found?
Yeah, well, I wrote a Google review recently sharing some of this, because I feel like the obvious effect that people are going to share is a change in their headaches, right? And at different times in the process, I think what happened for me was the intensity of the headaches lessened first, and then the duration of the headaches, and then the frequency. It was interesting, right? Because you and Dr. Gutwin, I feel like we're always reminding me there's different ways of measuring this. It's not, that all of those matter, even the response to things like ibuprofen. But then what's been fascinating to me is some of the other benefits and progress and improvement I've seen that are not necessarily headache pain. And those things have been like my teeth fitting together in a more normal way. Again, it feels comfortable because my jaw had just been so tight before coming here. Sleeping better. A big one that I did not expect is just a decrease in this low-level anxiety that I was experiencing for quite a while. And I remember talking that through with you, and how, when you're in this state of constant pain, it's kind of almost this low-grade fight or flight state that your body is in. And so I remember going, I think therapy, counseling are so valuable. And I remember going to my counselor a few times in a row and saying, this anxiety level has decreased significantly. Yeah. And that just gives a whole lot more margin for tolerating other stresses. And there's plenty of things that come up in life. Life is plenty hard and challenging without the addition of headaches. And so, seeing improvement in that, more energy. Yeah. It's funny again how we cannot connect things together, but a shoulder injury that kind of would flare up and here and there periodically before I started treatment here has not flared up at all since we did that work on my shoulder. And so, it's been really fun to see things that I was not looking for or expecting to resolve getting better. Has been pretty amazing. So I don't mean to paint a picture of, everything is all better in my life now, but truly it's better than I would have expected coming in to this program. And I can say that very authentically. So yeah,
that's great. And we appreciate you saying that. Ultimately just hearing someone's life-changing story and getting your life back, it's a big deal. And I told you before the podcast, we're hearing these stories is a reminder of like why this work needs to be done. And sometimes it does get a little bit fatiguing, or should I say discouraging, when like recording a podcast, being on social media, educating people, giving away a free half hour so that we can like hear your story and empathize with you. And and like when you get a no, it's like, like we were so close to being able to take you through this process that we know can change your life. So hopefully this story is an encouragement to people, and people can relate to it, and and take that step. If nothing else, I think you speaking to those lifestyle changes, if someone listening to this just, again, go through the podcast and hear about the different things that we talk about and start making those changes. And there's a lot that you can do to help yourself. I mean, like you even said, just finding the right pillow was helpful. Sometimes there's a layer of tension we need to get through before you can, because you couldn't even like lay down on your back before we started. So, but yeah, any other thoughts before we wrap up, or?
I think I would just say to those who are listening that it's worth taking the chance or even the risk that this could be different than what they've experienced before. I think it is hard for me to imagine that someone experiencing any level of headaches or migraines would not have something to gain here. And, whether that's seeing you in person or, again, the podcast, it's just that's a wealth of information. And so, we live in a world where, it feels like people are trying to sell you something or get you to buy into something. And that's really not been my experience here. And so, I just have all the trust in you guys and what you're doing here. And I'm grateful that you were willing to take this step to kind of branch out and do this work and, help so many people.
Yeah. Thank you so much. Thank you for sharing your story. And for all you listening out there, it's a journey that we're continuing on, and we want more stories like Amanda's. And so, reach out to us, noveraheadachecenter.com. Call us 719-598-1010. And we want to hear your story. We want to give you that half hour of our time to make sure that we address any sort of hesitations you might have. We want to make sure that you fit with the people that we've helped in the past, and that you have confidence, at least to some extent, to take this step forward. But keep listening to the podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.